The following slides will cover what is an allergy, allergic reactions, the signs of a reaction, medication, further risks and the emotional impact. An allergy is when your body reacts to things that can be harmless to others. They can be caused by certain foods, animals, chemicals and even pollen. The variety and severity of allergies differs from person to person. There are 14 major food allergens in the UK and approximately 2 million people have allergies. An allergic reaction happens when the person comes into contact with their allergen. Allergic reactions vary from mild to severe depending on the person and allergen. A severe reaction is called anaphylaxis. Anaphylaxis is a severe allergic reaction affecting the whole body. It is at the extreme end of the allergic spectrum. The reaction usually comes on quickly, often within minutes of exposure to the allergen, but sometimes it can be hours later. Causes often include foods, insect stings, or drugs. The immune system is so sensitive that tiny amounts of the allergen can cause a reaction. Anaphylaxis can be difficult to identify. It is likely if all of the following three things happen. Think A, B, C. A is for airway, persistent cough, hoarse voice, difficulty swallowing or a swollen tongue. B is for breathing, difficult or noisy breathing, a wheeze or a persistent cough. C, consciousness, persistent dizziness, pale or floppy, suddenly sleepy, or collapsed or unconscious. Skin reactions are commonly associated with anaphylaxis. Urticaria is the intensely itchy skin reaction which often occurs in an allergic reaction. Angioedema is an urticarial rash affecting a deeper layer of the tissues causing swelling. Flushing of the skin, where the skin goes a pinky red all over, can also occur. Skin changes on their own are not a sign of anaphylaxis and in some cases don't occur at all. Some people may suddenly collapse or become unconscious. Other signs can include abdominal pain, nausea or vomiting, and some people will have a strong feeling of impending doom. Adrenaline is the main form of treatment and it starts to work within seconds. It is prescribed in the form of an adrenaline auto-injector that injects into the thigh muscle. EpiPen, Emerade and Jext are three brands of adrenaline auto-injector prescribed in the UK. Anaphylaxis can come on very quickly, so treatment must be given quickly. When administered, adrenaline opens up your airways, reduces swelling and raises your blood pressure. The adrenaline auto-injector should always be given into the muscle of the upper outer thigh. Hold the injector with the needle tip facing down, inject and hold in place. Remove and store the auto-injector safely. Gently rub the injection site for a few seconds. Call 999 even if symptoms are improving and say anaphylaxis. Administration of the adrenaline auto-injector device can differ depending on the brand. In the description of this video, you can find links to the three most commonly used devices in the United Kingdom and how to use them. The adrenaline device should be used without delay if the reaction could be anaphylaxis. The individual should lie flat with their legs raised. It may help to make breathing easier if they sit up a little, but if there is any sign of low blood pressure, for example feeling faint, they must lie flat. Further risks for those with allergies can include kissing. Allergens can remain in the saliva for several hours, anywhere between 2 and 24 hours, and even brushing teeth before kissing may not get rid of them effectively. If you have an allergy, always check with the other person if they have eaten food you may be allergic to. Alcohol and non-steroidal anti-inflammatory drugs, for example ibuprofen, can increase the severity of an allergic reaction. Recreational drugs and alcohol might affect your judgment, so early signs of a reaction are not spotted and appropriate action is not taken in time. Many people with severe allergies have asthma. Smoking is likely to make asthma worse, and poorly controlled asthma can make severe allergies much more dangerous. If you have an allergy, it is up to you to make your allergy known to your friends. It is not embarrassing and helps to keep you safe. Let them know where your medication is and show them how to use it. Don't be tempted to share food and drinks. Practice good hygiene to prevent cross-contamination of allergens, and make sure to carry your adrenaline auto-injector with you at all times. Thank you for listening. For further information, you can visit the anaphylaxis.org.uk website. The link is in the description of this video.